The Association of Gynecological Endoscopy Surgeons (AGES) is a Nigerian not-for-profit organization registered with the Corporate Affairs Commission on the 4th of April 2018 with the objectives to improve the quality of healthcare services for women in Nigeria and abroad. AGES seeks to educate through its continuing medical education workshop series for gynecologists and professionals to promote the benefits of minimal access surgical care for women and through the certification and accreditation of training institutions. It promotes research and innovation in gynecological endoscopy and seeks cooperation with other national and international organizations. It also engages in all other lawful charity projects deemed appropriate and approved by the board. Hear from the AGES president and the director of training.
Good day, everyone. My name is Dr. Olajuwon Alabi. I'm the current president of AGES Nigeria. And AGES stands for an association whose members have a common interest in developing gynae endoscopy in Nigeria. This was started in 2017 and is grown up to date. We have about 150 members, and everybody doing great in a respective part of the country. Okay, so the AGES training program is to further strengthen our members in terms of gynae endoscopy, knowing their strength, developing their strengths, and also encouraging other gynecologists in Nigeria to be aware of the opportunities that are available to train in gynae endoscopy. So that's the reason we created a training program. Thank you.
I am Abdulhakeem Akintobi, the Director of Training AGES. AGES as an association has identified gaps in our various training institutions with regards to minimal access surgery, especially in the field of gynecology. And for us to fill in this gap, we've deployed the resources that we have within AGES, both local and international, to design curriculum for training in minimal access surgery. And I'm happy to announce that on the 7th of May 2024, we organized our first basic training in minimal access surgery in collaboration with Benue State University Teaching Hospital, Makurdi. A very wonderful experience, both for us, the trainers, as well as the trainees. I want you to follow us on this journey.
Welcome to the Benue State University Teaching Hospital Makurdi, the heart of medical excellence in the region. The Association of Gynecological Endoscopy Surgeons, in collaboration with the Benue State University Teaching Hospital, is proud to present the recent groundbreaking training program on basic training in minimal access gynecological surgery. This 3-day intensive training brought together consultants and resident doctors from Benue State University Teaching Hospital who were eager to advance their skills and knowledge in gynecological endoscopic surgery. The AGES team was warmly welcomed by Professor Andrea Avashima Ongizi, head of the Department of Gynecology and Obstetrics. In her words, "We are honored to host this significant training program. It is a testament to our commitment to medical education and excellence." The Chief Medical Director of the hospital, Dr. Stephen Taromwa Hwande, extended his heartfelt welcome to the participants and facilitators. In his words, this collaboration marks a pivotal moment in our journey towards enhancing surgical care and outcomes for our patients. The training was facilitated by esteemed subject matter experts from AGES, including Dr. Olajuwon Alabi, Dr. Adebayo Adule, Dr. Abdulhakeem Akintobi, Dr. Karir Diamu, Dr. Bolarin Diola, Dr. Paulinus Abu, Professor John Imaralu, and Ms. Adenika Olokun. Participants delved into various critical topics, starting with the design and setup of laparoscopic and hysteroscopic instruments. Understanding the intricate design of these instruments is essential for effective and safe surgical procedures. Precision and efficiency in hysteroscopy begin with mastering the tools of the trade. Ergonomics in minimal access surgery, another key topic, was thoroughly explored to ensure surgeons maintain optimal performance and reduce fatigue. Proper ergonomics are crucial for long-term success and health in the operating room. The training also covered laparoscopic surgical anatomy and access techniques, providing participants with a comprehensive understanding of the human body's landscape from a minimally invasive perspective. Accurate anatomical knowledge is the foundation of all surgical practice, especially in minimal access surgery. Electrosurgery and electrosurgical safety, along with managing complications, were critical components of the training. Safety in electrosurgery is paramount to prevent adverse outcomes and ensure patient well-being. Hands-on practical demonstrations, including dry lab sessions and theater diagnostic and operative procedures, provided invaluable real-world experience. Under the guidance of the facilitators, participants practiced instrument handling and procedural techniques. The theater sessions showcased live diagnostic and operative procedures, integrating theoretical knowledge with practical application. Proper care and sterilization of instruments are crucial for maintaining surgical standards and patient safety. As the training concluded, participants left with enhanced skills and renewed confidence in minimal access gynecological surgery, ready to implement these techniques in their practice. The hope is that this training marks the beginning of a new era in surgical excellence at Benue State University Teaching Hospital. Let's hear from some of our facilitators again.
Hi, I'm Mr. Bola Indiola. I'm a consultant gynecological, reproductive, and minimal access surgeon based in Sheffield, United Kingdom. I have been a member of AGs for over 7 years, and it is my privilege to be associated with an organization that impacts knowledge, attitude, and skills in reproductive and general gynecological endoscopic surgery in West Africa. AGs has been the main platform in Nigeria and indeed in West Africa for new surgeons to develop competencies, and also for older, more experienced gynecologists to develop their continuing professional development and proficiency in more advanced gynecological endoscopic surgery. AGS is doing a fantastic job, and I'm really very proud to be part of it. Thank you very much.
Hello everyone, I am John Imaralu. I work at the Babcock University Teaching Hospital. I am a member of AGS and I've been with AGS since 2017. It's been a very fruitful journey. I want to thank the President and the AGS ESCO for giving me the opportunity to be a facilitator at the recently concluded training in basic endoscopic surgery in gynecology at the Benue State University Teaching Hospital, Macaulay. It was an eye-opener. I want to advise the trainees that they should start practicing their skills as soon as possible. And I want to advocate that the administration procure equipment for them. The earlier they practice their skills, the better they'll get at it. I want to thank the administration of Benue State University Teaching Hospital for the warm welcome given us and the enabling atmosphere they gave us to do the training. I also want to say I was really impressed by the dedication, the enthusiasm of the resident doctors and the consultants and the support staff of the teaching hospital. It was awesome. I want to thank once again our co-facilitators who were also there. Many of whom are our senior colleagues. They were there and they made sure that training was done, and I want to thank them for the quality of the training. Once again, thank you, AGS. Long live AGS. Thank you.
Here I am again, the Director of Training AGS. Talking about our experience at Benue State University Teaching Hospital, this is an opportunity for me to actually appreciate the Chief Medical Director, a fantastic administrator, Dr. Wande, and his team, the Head of Department of Sangani, Professor Sandra Onguze, with a wonderful team of senior consultants, junior consultants, resident doctors, and the perioperative nurses. Everybody was quite enthusiastic and hardworking. It was a wonderful experience, and the feedback we got from the trainees were quite encouraging, and we are going to work on all the suggestions that have been offered. And now, having done this training successfully, we do know that we have the capacity to deploy the same training to any other institution that is willing to have their manpower trained in minimal access surgery. So if your institution wants us to conduct training in minimal access surgery, why not reach out to us today? Reach out to the Director of Training AGS. You can do that through Aegis members in your region or your state or in your institution, and then who can put you on our schedule, and we're more than happy to come and train your manpower and build capacity for minimal access surgery and also provide support moving forward. Thank you very much.
Thank you to the Association of Gynecological Endoscopic Surgeons and Benue State University Teaching Hospital for making this transformative training possible. Together, we are advancing the future of gynecological surgery one step at a time.